We will discuss retinal breaks. So what are retinal breaks? These are the full thickness defects that are present in the retina. They can be of many types. Now we will discuss here 4 types of the retinal breaks. They can be holes, they can be tears, they can be giant retinal tears which are bigger tears, and they can be a dialysis, which is the separation of a retinal tissue from the anterior part of the ora serrata. Now let's discuss these holes, these tears one by one. First of all, what are the holes? Now the holes are the full thickness retinal defects that are present in the anterior, in the retina. So mostly these holes are present in the areas for degenerations. They are atrophic patches of the retina. That's why they are called atrophy of the retina. And there is no vitreomacular traction present in these holes. Now these holes are mostly associated with the retinal degenerations. Now you can see in this diagram and the peripheral part of the retina, these are the holes present along the degenerations, and there can be an isolated hole, or they can be present in the form of the groups. Mostly we do not treat these holes when they are present in the peripheral part of the retina, and they are usually asymptomatic. They do not cause any symptom to the patients. Next type of breaks is the tears. Now what are the tears? Tears are the full thickness defects that are caused due to PVD or posterior vitreous detachment. They can also be caused due to trauma. Now how they creates a break? PVD basically causes attraction on the retinal tissue. When it gets separated forcefully from the retina, it creates a break or a tear. Now these breaks or tears can lead to retinal detachment. Now one of the dangerous type of tear is the U-shaped defects. These are the full thickness defects that are usually present in the retinal tissue. Now in the shapes are of different types in these breaks that are called tears. So what are the shapes? They can be L-shaped, they can be V-shaped, inverted V-shape, or they can be C-shaped or U-shaped tears that are mostly present. You can see in this diagram in the peripheral part of the retina and on the posterior pole, you can see these breaks that are present in the retinal tissue, and they are the main cause of creating retinal detachments. The other type of breaks are giant retinal tears. Now giant retinal tears are mostly caused by two main causes. One is the trauma and the other is the high myopic patients. Now these two categories are very important, and they should be screened for giant retinal tear if they complain of any detachment present in their eye. Now other causes can be Marfan syndrome and Stickler syndrome. They are also associated with the giant retinal tears. So what are giant retinal tears? They are tears more than 3 clock hours or up to 90 degrees. 3 clock hours are equal to 90 degrees. So they are mostly present in the peripheral or posterior to the aura, and they are associated with trauma, high myopia, Marfan syndrome, Stickler syndrome. Now you can see in this diagram a giant retinal tear that is present. It starts from 6 o'clock to 9 o'clock. It means it involves 3 clock hours, which is 9 o'clock, and this is 6 o'clock. 6 to 9 or 90 degrees giant retinal tear. The other type is the dialysis. Now the dialysis are mostly circumferential. They are present along the ora serrata. Now full thickness circumferential breaks that are present at ora serrata. They are mostly associated with trauma. The most important location in the cases of dialysis is the infratemporal region, and they are not related to the PVD as in the case of the breaks that are created by PVD. These breaks or these dialyses are not created by the PVD. They are mostly at the ora serrata, and the posterior PVD is mostly the posterior vitreous detachment. Now you can see in this diagram, this is the part of the dialysis that is present anteriorly. Now you can see from this side to this side configuration, this is caused by dialysis, and this dialysis can lead to retinal detachment, and they are at ora serrata. Now how will you treat these different types of breaks? We will discuss them in the next slide. Now treatment is, first of all, U-shaped tear. If the U-shaped tear is present, then treatment is must, and we will do treatment by laser photocoagulation if it is present. There is no discussion in case of U-shaped tear whether it is asymptomatic or it is symptomatic. You have to treat it when it's present. It can be treated by a laser photocoagulation, or it can be treated, if it is causing the retinal detachment, it can be treated with the help of a sponge. The other type is asymptomatic hole. Asymptomatic hole do not need any treatment. It do not cause any it usually do not causes any symptoms or sign to the patient, and it is an incidental finding that is noted when the examination of the retina is done in a patient with other pathology, that when he or she comes to you for the examination. The other type is dialysis. Now dialysis, as I discussed in the previous slide, it is present at the ora serrata. So this is treated with the help of the scleral buckling or circumferential buckle that is used to treat the dialysis. The last type is the giant retinal tear. Now in case of giant retinal tear, we usually prefer to do vitrectomy plus tamponade plus endo laser. In some cases, we may or may not opt for encircling band, as the chances of slippage is very high in cases of giant retinal tear. Also, the chances of redetachment are very high in cases of giant retinal tear. So mostly we prefer to do an encircling band along with the vitrectomy and tamponade, followed by a laser. So thank you very much. These are the different types of the breaks.